What if a small blister on your foot could cost you your leg? For millions of people living with diabetes, that's not just a scary thought, it's a real risk. Diabetes does just affect the blood sugar. It can slowly damage the nerves and blood vessels in the legs and feet, making it hard to feel pain or notice injuries. And when wounds go unnoticed, they don't heal. They get infected, and the infection tends to spread. But here's the good news. Most of these complications are preventable. In this video, we'll explore what diabetic foot is, why it happens, how to recognize the early signs, and, most importantly, what you can do to protect yourself or a loved one. Because living with diabetes means more than just managing blood sugar. It means protecting every part of your body, especially your feet. One of the most serious and preventable complications of diabetes is what's known as diabetic foot. It can lead to chronic wounds, serious infections, and in some severe cases, amputation may be the only remaining option, causing significant emotional and physical stress for those affected. When this condition progresses, treatment can become difficult, often resulting in unsatisfactory outcomes for both the patient and the doctor. In fact, diabetes is one of the leading causes of lower limb amputation in the developed world. This condition develops gradually, usually many years after the onset of diabetes. It's driven by two major problems: nerve damage and poor blood circulation. Together, they create the perfect storm for injuries that don't heal and infections that spread. Both are caused by prolonged high blood sugar levels. Along with high blood sugar, factors such as high blood pressure, elevated blood lipids, and smoking can accelerate the narrowing of blood vessels. Once wounds form, they are often difficult to heal and can lead to serious complications like infections and bone damage. The earliest sign is usually loss of protective sensation in the feet. The affected individual might stop feeling pain, heat, or cold. Some people might experience strange sensations instead, like tingling, burning, or odd feeling of walking on cotton. Others may not feel anything at all, even when a wound develops. As circulation worsens, the skin of the lower legs and feet changes, becoming dry, thin, and prone to injury. Hair loss on the legs is common. Wounds often appear in pressure points, the toes, heels, or sides of the foot. Because sensation is lost, many people don't realize they injured themselves until an infection is already underway. Nerve damage can be so severe that minor surgical procedures can be performed on the foot without anesthesia. However, when wounds do form, they tend to heal poorly due to reduced blood flow to the area. These wounds are particularly susceptible to infection, which may present with redness, swelling, and warmth in the feet and lower leg. In more severe cases, an infected wound can lead to sepsis or bone damage. In the advanced stages of the disease, gangrene may develop in the toes, leading to blackened, dry tissue, often exposing the bones. Once complications related to diabetic foot arise, treatment becomes exhausting for both the patient and the healthcare provider. Therefore, education about proper foot care, appropriate footwear, and self-examination of the feet is essential. Tight control of blood sugar levels is crucial to halt disease progression. Additionally, blood pressure and cholesterol levels must be carefully managed. Lifestyle modifications, including weight loss, regular physical activity, and smoking cessation, are also recommended. When a wound occurs, it is vital to clean and bandage it regularly. Infections are treated with antibiotics and appropriate wound care. If blood vessel narrowing or blockage is detected, procedures such as stent placement or bypass surgery may be necessary. Medications to improve blood flow through the leg may also be prescribed, although they are usually not a permanent solution. In the most severe cases, if gangrene or bone infection occurs, amputation of a toe, part of the foot, or even the lower leg may be necessary. Given the severity of diabetic foot complications, prevention is of utmost importance. Maintaining strict control over blood sugar and associated risk factors like high blood pressure, high cholesterol, obesity, and smoking can slow or prevent further damage to the nerves and blood vessels in the legs. Affected individuals should receive thorough education on the nature of their condition, as well as on proper foot care and self-examination techniques. For instance, individuals should inspect their feet daily for any changes in the skin, including scratches, redness, blisters, or wounds, and report any findings to their doctor. They should wash their feet every day with lukewarm water, avoiding hot water. After washing, it is important to dry the feet thoroughly. Nails should be cut straight across without trimming the edges. If there is any thickening of the nail or sores on the toes, this should be reported to a medical provider. Comfortable footwear that does not constrict the foot or cause friction should be chosen. Walking barefoot, even at home, should be avoided. No attempt should be made to remove any skin changes on the feet except by the trained medical professional. Additionally, individuals should never warm their feet on heating pads, radiators, or in hot water. Engaging in foot-friendly physical activities such as walking, swimming, or cycling can help maintain circulation and promote foot health. Diabetic foot doesn't have to be your story. While this condition can be severe, even life-changing, it is also largely preventable. By taking small steps each day to care for your feet, checking for early warning signs, and managing your blood sugar, you can protect yourself from many of the complications that lead to infection or amputation. Early action saves feet and lives. If you have diabetes, don't wait until a problem appears. Talk with your healthcare provider about how to keep your feet healthy and make daily foot care part of your routine. Because every day you look after your feet is another day you stay active, independent, and in control of your health. Thanks for watching. If you found this video helpful, consider subscribing for more educational content. Have a great day.